Hi everyone, this is Courtney from Prevent Blindness, Wisconsin. I'm super excited to be joining you guys today because we are starting, that's right, day one of our 5 days of adult vision health series. So basically what we're going to be doing in this 5-series segment is these are mini educational sessions going over the 10 questions on our adult vision health risk assessment. So in each educational session, I'm going to go over 2 questions, their importance, and why we have them on our risk assessment. This is a super effective and efficient tool when we're screening clients or also when we're training partners to use it, because 98% of adults don't pass the risk assessment. It's a great conversation starter too, because some adults, this is the first time they've ever had that conversation on their vision health. So let's start it together. So the first 2 questions on the risk assessment that we're going to cover today are all centered around the eye disease glaucoma. All right. When you think of glaucoma, I want you to think of the pressure levels in your eyes. So the first 2 questions on the risk assessment are: 1, do you have blood relatives with glaucoma? And 2, has a doctor ever treated you for or said you have glaucoma? All right. So before we dive deep into glaucoma, how it affects the eyes, different risk factors for this, and why these questions are so important, I like to give a visual for people. So this would be normal vision without glaucoma. You can see we got that beautiful field in front of us, crisp blue skies. And then this could be vision for someone with severe glaucoma. So typically symptoms are gradual side or peripheral vision loss for some people, and then it gradually can come into the center if we are not seeking that regular treatment. So you can see it can be really a debilitating vision concern for a lot of adults, especially as they age. So glaucoma, there's 2 different types that we typically cover. There are more out there, but these are the common ones we do cover, especially going over the risk assessment as well: open angle and closed angle. So now this all has to do with fluid flow in your eye and out of your eye to the rest of your body. Okay, so I'm going to cover these 2, but I think the best way to show this is going through the eye itself and how that works. Okay, so first I'm going to go over how do we see things in front of us clearly. So for us to see things clearly, light comes in through the cornea of your eye, that's the very outside of the eye, comes in through the pupil in the center of your iris here, passes through the lens of the eye, and then that light is reflected on the back of the eye. This is called our retina. Light then is sent from the retina to the optic nerve. Now the optic nerve is the area, the main area we do see damage being done from glaucoma. Okay, so the optic nerve is made up of millions of bundles of nerve fibers. Those nerve fibers carry those light signals from the retina to the brain, and that tells you what you're seeing. So we have got some complex systems going on here with our eyes, all right? But focusing on glaucoma, again, glaucoma really affects the optic nerve over time. If we have a more severe form, closed angle, we'll cover that in a little bit, it can affect it very rapidly, okay? So with our eyes, with glaucoma, I'm going to focus on this anterior portion of the eye, okay? So what's happening here is we have constant fluid flow forming in our eye, and then it goes out of our eye through our drainage systems into our aqueous veins and then into the circulatory system of the body. So what's happening here is we have this little epithelium patch, I like to call it, that forms aqueous humor. That's that fluid that forms in the eye, flows out of the eye, and then into the body. Okay, so this forms aqueous humor. This little portion down here does as well. So going back to our 2 types of glaucoma, open angle and closed angle, open angle is going to be the most common, you guys, okay? Pressure levels build up gradually because what's happening is that aqueous humor that's forming, it just flows through the eye at a slower rate. So pressure builds up gradually over time. So what's happening here, and I like how they did it in the title of the eye disease itself, open angle, okay? So fluid flows from this little epithelium patch here. This is our iris right here, and then this is the lens of the eye. Open angle glaucoma, this angle right here between the iris and the lens is nice and open for fluid to flow through. So that's open angle glaucoma. However, in each section around those little epithelium and iris, we have little trabecular meshwork, okay? So this is kind of the filter system for the aqueous humor to flow through into the eye and then out to the body, okay? So when you think of that trabecular meshwork, I want you to basically think of it like a sponge that helps carry that fluid through to the canals of the eye and then out to the body, okay? So open angle glaucoma, you have this rounded bend here and down here nice and open. However, we might have some blockages or clogages occurring in that trabecular meshwork, or as it flows through the trabecular meshwork, it flows into this huge canal here called Schlemm's canal, okay? That's that main gateway system that carries all that aqueous humor, and then it pushes out to aqueous veins and then into the rest of our body. So what's happening here in open angle glaucoma is either the trabecular meshwork might be clogged a little bit, or we might have a little bit of a blockage in Schlemm's canal coming off that meshwork, all right? So if it's clogged, fluid is not going to flow through at the rate that it should, so pressure builds up gradually, causing those early signs of glaucoma. So I want you to think of that very similar to a colander. That's right, I gotta put it in layman's terms for people. You will not think of spaghetti the same way, all right? So I like to think of open angle glaucoma by showing you this colander, okay? So what's happening here is open angle glaucoma. I want you to think of this as you made spaghetti tonight for dinner, you put it in the sink and you're rinsing it, right? So with open angle, these are nice and open. I want you to think of these systems, these little dots here, as that angle for that fluid to flow around into the trabecular meshwork. So these are nice and open, so fluid flows through at a great rate. Awesome. However, we do sometimes get a pesky noodle that gets caught down in the sink. Might slow fluid flow. However, it still eventually drains. That's the same thing with open angle glaucoma, you guys. So we have the angle opening, nice and open. However, the trabecular meshwork or somewhere along Schlemm's canal, we have that blockage occurring, okay? So that's why pressure builds up gradually. Going back to closed angle glaucoma, this happens when the angle between the iris and the lens is completely blocked. Okay, there's nowhere for that fluid to go. So it's going to build up rapidly. All right. Going back to our colander with closed angle glaucoma, again, I want you to think of the colander very similar to where that fluid forms and then flowing around that angle between the iris and the lens. If you have fluid building up, it's going to increase pressure over time. So say that you're rinsing your spaghetti in the sink, all right? And with closed angle glaucoma, you might have one section of your colander or all sections of your colander completely blocked. So there's nowhere for that water that you're rinsing your spaghetti in to go, so eventually it bubbles over the top, okay? So that's the basics of the two different types of glaucoma we typically cover, okay? So over time, basically what happens is as you have a pressure buildup, either in the trabecular meshwork, Schlemm's canal, or here in that area between the iris and the lens, that causes the lens here to push against, this is called the vitreous portion of the eye, pushes against the vitreous portion, and then that causes pressure to radiate to the retina and then to the optic nerve, okay? That's why it damages the optic nerve over time. So this is just a great visualization of glaucoma, especially that open angle glaucoma happening over time. Thank you, Jeff McClellan at Brannigan Communications. Their team designed this and it just depicts it beautifully. So I had to give you a shout out for this. But you guys can really see that peripheral side vision loss happening. I think the saying on this just says it perfectly. Picture is worth 1,000 words. How many words is a picture worth with that severe untreated glaucoma? So there's different risk factors, and this is where I'm going to go back to that risk assessment portion of the risk assessment. So if we have, number one, do you have blood relatives with glaucoma? Glaucoma is a very hereditary disease. So we typically say if you have family history, so a blood relative, say your mother, your father, a grandparent, has glaucoma, we do consider you at risk for that disease. Now, there are populations that also are going to be at an increased risk for glaucoma, and that includes African Americans, Hispanic and Latinos, and then we also are seeing Southeast Asian Americans as well at risk for this disease. Does not necessarily mean other demographics cannot get glaucoma. These are just a little bit more at risk for this. So if you do have family history, we do consider you at risk. So that is why on the risk assessment, we do ask, do you have blood relatives with glaucoma? Just because we see that linkage so high. Also, going into the second question, has a doctor ever treated you for or said you have glaucoma? Glaucoma is a chronic condition. So once someone is diagnosed with it, we do have it for life. And it does require ongoing treatments to either stabilize the pressure in the eye or adjust how much fluid is either being formed in the eye or the outflow of fluid from the eye to the rest of the body, okay? Some people might just have a regular high eye pressure. Doesn't necessarily mean they have glaucoma, but it is something that we do like to monitor a little bit more closely. People who age as well, so we typically say people 40 years and older are more at risk for the disease, and males are going to be at that increased risk as well. Again, doesn't mean females will not have it, but just puts them at that increased risk. So this is where I'm going to hit her home with the dilated eye exams. So I really want to stress for people, going into the eye doctor, there is such a difference between dilating the eye and not dilating the eye. So I get it, dilation can be a pain. I know it takes an extra 30 to 40 minutes. And then afterwards, the eyes are very sensitive. Sometimes people can't drive afterwards, depending on the person. But you guys, this so makes or breaks sometimes a diagnosis. You can see in this image of the undilated pupil, we have a very narrow snapshot of the back of the eye. When you dilate, the eye doctor can see everything going on, all the veins in that retina, and up, here we go, the optic nerve. What does the health of that optic nerve look like, especially if someone is at risk for glaucoma or has glaucoma? Someone put it into great terms for me. Undilating someone's eye is like looking through a little mini keyhole in a door. When you dilate, it's like opening that entire door and being able to see everything going on. So I really want to stress that dilation piece here. So again, do you have blood relatives with glaucoma? Again, that puts you at risk for that eye disease, glaucoma, okay? Or that series of eye diseases under glaucoma. Also, has a doctor ever treated you for or said you'll have glaucoma? Again, it's that chronic condition, and it's so important to monitor it over time. So that ends our day one of our 5 days of adult vision health. I hope you guys enjoyed that segment. I want to put a shout out to, again, Prevent Blindness Wisconsin. While we might be remote right now, we are still very active with our partners doing educational series like this as well for the general public too. So I do want to put out, we do have a Venmo account. We do have a 2020 Vision Challenge going on. So if you watch this and you enjoyed it, you learned something, I challenge you to promote to our cause and donate $2.20. We are doing this with every partner, every event that we're doing, just to kind of keep our mission and vision going. I hope you guys enjoyed this, and I hope that you have a wonderful day, and stay tuned for next week as we go into day 2 of our 5-segment series. Thanks, everyone. Bye-bye.